And we started. We're here. Good. Everybody, make yourself cozy, comfortable. All right. So let me explain to you as I go up here and show you with the content aspect of it. So I loaded this nutrition and physiology is the one I'm going to record a lecture. There's not. It's a lot of stuff in the chapter we really don't need. You're going to see the big areas and get it recorded. I mean, I have an outline that's relatively comprehensive about that you will see called the growth outline. There's a lot of stuff. The things that are significant are temperature levels, availability of air, a minimal amount about nutrition, and probably a little bit about pH. But the most important part, clearly, is the bacterial growth curve. And I even put an additional notes that I did this morning about this. You'll find this to be really, and so again, I did these ages ago, just to show you what it looks like here, if that makes life any easier. I mean, you can see all these things. If you see any figure references, a lot of this is good for lab, like pure cultures. And this is the growth curve information that you will see, rearing its ugly. Here's temperature requirements. So everything I have to discuss is probably here, toxic derivatives of oxygen. So there's a bunch of stuff, but if you listen to the lecture, that's really where a lot of this, when you get to media and stuff like that, that's lab. But when I put these together, I had incorporated both the lecture and lab I was doing together. When I start to do these handouts things, I was doing them both up in CCAC and BC3. But this bacterial growth in laboratory is really significant. So you can see there's a lot here. But if you listen to what I present to you in the recording, I minimize it. I used to do all this stuff, but there was so much overlap with lab, I don't do it. So I'm not doing it now. I want to start viruses. Viruses are more important and a lot more relevant for our discussion. The chapter in this text is not great for viruses because this is what I call a clinical chapter that we're going to start. So I will have it for you, and here's viruses and prions. But when I say clinical, what I will be doing in this, obviously we have to talk about the anatomy and to some extent the relatively limited physiology of viruses. But the reality is that this is the time you got to understand how they're classified now. And so I'm going to look at different classifications, not really going into detail into diseases. We do that toward the latter third of the course. So that'd be something we would unlikely to start until after break. The different types of diseases and their relevance. We'll start talking about the flu, and we'll talk about COVID, and we'll talk about chickenpox. But here, I'm going to talk about when we get to it. It won't be today. We'll be when I return, so a week from today. We'll start beginning to look at the different things that herpes viruses, where they're classified, and HPV, and norovirus, and all of those things, how they spread. Some little nuggets about them, why there's some problematic ones that cause cancer, ones that have an alarming tendency to stay with us, doing something called latency. So that's really where I use this chapter. And for me, this is really the introductory part. And I would feel much more comfortable doing it in front of you than not. You're going to see, and really, if you want to boil it down to simplicity, we really classify viruses three things. You're going to see this will be repetitive. We talk about their genome, meaning what is the genetic material. And this is interesting because it's very atypical. And you'll hear me say it 1,000 times. I've already said it. DNA or, and the big word is or, never both. So we'll talk about DNA viruses and RNA viruses. 2, some viruses are called naked. Another term, and that's a colloquial sort of a term we use scientifically, means non-enveloped. And the envelope is a lipid, you might guess, membrane versus envelopes having that membrane around it. That's a really significant classification because anybody who teaches loves counterintuitive things. Which one of those is easier to get rid of in the environment? Oh, it must be the one that's naked. It doesn't have the envelope. Other way around. So that extra layer is not a layer of protection, it's something you can attack. And you'll find, that particularly in living systems, the more simple the agent is, the harder it is to deal with. When you add complicated layers of things, it's a lot. I mean, there's multiple targets. Every time you add a layer, it's like your car. You get a car with this computer and that and this door. It's, side scans are all wonderful for safety until they go wrong. Then they cost a bundle to fix. So when it comes to viruses, it's KISS. Naked viruses are simple. Normal. HPV. They are naked viruses and they're a pain in the cum. Always what is hard to get rid of. And then lastly, what you might call its shape or its architecture. You're going to see that they basically fall into three categories. Okay? Let's see. One's a fancy term called icosahedral. And that's 20 identical sides. It's like, think of the best analogy, if you like board games, it's like a 20-sided die. You ever get one of those board games where you have like 8-sided, 12-sided dies, things like that? This one would be a 20-sided. Because it's all equilateral triangles, the nickname we give it is isometric. HPV. Normal. Influenza. So I mean, this is by far and away the most common. And then after that, okay, not quite done yet, we have what some people call helical filamentous. So it's kind of, rather than being just geometric, it's more linear. You want to think of it that way. So we don't call it linear. We call it helical or filamentous. What would be an example of that? Ebola. Rabies. And then after that, those are the two big categories. And after that, we usually use one or two different terms. Sometimes we'll call them cleiform. Clea kind of means many different. So some form, not one of those popular. Sometimes you see in different systems refer to them as complex. We'll get into all. For the most part, they're going to either be DNA or RNA, naked or enveloped, isometric or helical or filamentous. That's where most of them are. And it's the old story, you remember the oddballs. Most of them, to be fair, are in that isometric category. COVID's interesting, but its outer shell, its architecture is isometric. It's enveloped. Like I said, people went nuts about COVID. Oh my God, it's everywhere. I don't want to touch anything. They're still wiping off their shopping carts. Give me a break. I mean, for somebody's dirty hands, I could understand it. Okay. But the reality is, it doesn't last on surfaces very long. It just doesn't. Despite people going absolutely ballistic over things like that. Just to give you an idea, and that's part of what I'm presenting to you here. When something new happens, every time you hear about a virus, all of a sudden everybody goes, oh my God, There's a variant. We're all going to die tomorrow. We're not. We didn't die yet. Okay? Just, I present the information. You react the way you want to. You're going to get my spin on it. But I always classify spin as spin. Okay, so let's just, the filterable is not a big deal to us. And they're not living because they have DNA or RNA, not both. And they're not made out of cells. All the things that make living, they're not. So when you hear, and I'll do the same thing. I'll phone, how do we kill the virus? You can't kill the virus. When we get to antimicrobials, we're going to see virucidal, which means killing the virus. It's a misnomer. They're dead. They're not alive. They're not dead. You can't make them dead. Active or inactive. Period. So, I mean, again, you're in nursing and they say, we have to get something that's virucidal to kill those viruses. Do not. Dr. Stein said they're not living. Okay, unless you want to have a problem. Just look at them and go, yeah, very good. Thanks for pointing that out. It works, trust me. Prepared, polite, all that kind of stuff. Stop. Let's just see. Viruses can affect everything that's living. Animals, plants, bacteria, eukarya, archaea. Anything that's living and made out of cells can get a virus. So bacteria can get a virus, archaea can get a virus, you and I can get a virus. Plants can get a virus. They're indiscriminate, all living things. 10 million viruses per milliliter in seawater. Oh my God. I'm not going in the ocean. I'm going to be right by the ocean. So I don't want you to worry next time you go in the ocean. Okay, you're not going to worry, are you? There are all those viruses there. I hope not. Trust me, the salt will help you. So the cause of viral infections was unknown. And so Pasteur was the first one. He coined the term virus, which is Latin for poison. And really it's fairly accurate. They act a little bit like poisons in the sense that most of the damage they do comes from two things. They inherently, when they attach to cells, when they invade them, they cause the cells to be destroyed. Okay? So if the cells are lining blood vessels, you get what's called a hemorrhagic virus. It's kind of like Ebola. And it breaks down the blood supply, blood clots, and blood supply can't get to organs. And you see hemorrhages on the skin. I'm giving you an idea. We're going to go into this in much more detail later. The other thing that really most of their damage were bacteria. Most of the damage they do is from toxins, period. Endotoxins, from gram negatives, or mostly exotoxins, which both gram positives and gram negatives give off. Viruses, nuh-uh. They may primarily damage the cells when they invade, but the reality is most of your response is what we call indirect. Your immune system. It's the common cold is your immune system. COVID is your immune system. COVID is what's called pro-inflammatory. It attaches to particular cells in the respiratory tract. And because of what it effectively does to those receptors, they don't make things that reduce inflammation, they make things that accelerate inflammation. More bizarre, or depending on your own genetic basis and a variety of your own health, it can be life-threatening. Just to give you an idea. So, you got to start thinking viruses don't behave the way, because they're not a living thing. Tobacco was really where we first identified virus. Why is it studied so much in tobacco? Understand the biggest cash cow of them all. From the discovery of us, the New World, up until, 1964, when the Surgeon General's report came out about the harm of smoking, tobacco. Okay. That whole Spanish Armada thing, you know what that was about? Tobacco. Follow the money. So, and then, this is foot and mouth disease. They discovered a virus that was affecting cattle. Understand that it wasn't just cattle. I mean, it was not just cows per se. It was a lot of different species that were subject to use, and that affected food supply. That affected, again, revenue. Filterable meant that, and when they describe that, I don't care about this. It's just interesting. It means that it'll trap the bacteria, but the fluid that filtered through still was infectious. Hence, they call that a filterable virus. They're tiny. So are they alive? No. I can't answer the one about evolution. We'll look, biological is a misnomer because they're not living, et cetera, et cetera. We'll go over all of this. So the interesting thing is viruses, by definition, are what we call obligate, which means they have to be, intracellular parasites. The only way they can really damage you is they have to either damage one of your cells or invade one of your cells and flourish inside. And in general, they invade the cell and they flourish inside. And the end result, you may get better from the virus, your cells never will. Okay. Oh, the virus didn't, your cells have one or two things. They're either going to die or they're going to become a little factory to make more viruses, period. Again, it's a different way that things are. So we are infectious molecules all by it. They do not exhibit most of the life processes, but they can direct them. So they are more certainly than inert or lifeless, I would agree. So active or inactive is the way most people classify them. So they enter the cell. They take over the cell's machinery. Basically, they break apart the cell's DNA in many instances, not all. And what they start to do is basically turn it into a little factory inside. And they don't make one or two, they'll make hundreds, if not thousands of viruses. The cell will get bigger and bigger, and finally it'll burst. And then those will go out and infect, what do we call it, the burst size. So whether it's 500, that'll infect one cell, will have burst of 500. Those 500 will infect 500 more, and then 500 squared, 500, et cetera, et cetera. I mean, you start to get ridiculous numbers. That's why viruses like Ebola, for example, can easily kill in 3 to 4 days. Smallpox, easily kill 3 to 4 days. So you're dealing with immense amount of significance. Don't worry about the smallpox. We haven't seen a case since 1977. It's presumed to be eradicated. Because they have impacted our cells over evolution, as you can see, and I'm certainly not the authority, I'm just giving you the idea, we have sequences that we can identify from viruses up to 8% of our genome. Exactly what that means, if you did not know, only about 2 to 3% of our genetic material codes for characteristics that you and I have. Much of the rest of it is regulatory in nature, and that's, it's part of these long strands. There's things called operons. There's places where they begin and where they end. There's a lot of complexity. If you have to attend one of our genetics lectures or some molecular biology lectures to begin to see the complexity of how we actually replicate DNA and RNA. There's all sorts of these different patterns that are there. 10 to 20% of bacterial DNA, and this is it because they infect bacteria a lot, and it's very significant. Why is botulism toxic? You've got a virus. Why is diphtheria toxic? Both of these are deadly. Virus. That killer strain of E. coli I told you about, that we'll go over again, that H70157, from a virus. So viruses play a critical role. 15 to 30% of all cancers in us come from viruses. And about half of those come from one, human papilloma. What's that? Big player. So the best way I think to classify them, obligate intracellular parasites, that's pretty much the consensus, cannot multiply unless they invade a specific host cell and instruct its genetic and metabolic machinery to make more viruses. Like I said, It'll convert it into a factory, or it'll do the burst size number. And there's lots of those. HIV invades a white blood cell, converts it to a little factory to make more HIV, and then damages the single most important white blood cell in your whole system, called the helper T cell. Without it, your immune system collapses. It's exactly what happens in AIDS, and then you're going to die sooner than later. So, obligate intracellular parasites are bacteria, protozoa, fungi, algae, plants, and animal. If it's living, it's getting a virus. I can't even 10 with 31 zeros after it. I mean, even Avogadro's number pales. Remember him? 6.02 times 10 to the 23rd. You know, we did that. I always call it Avocado's number. Nobody cares. Approximately 10 times the number of bacteria and archaea combined. All right, a lot of viruses. They're everywhere. They're super tiny. I mean, you'll see the size chart. Not cells, do not independently fulfill. At the minimum, what you will see, they have a nucleic acid core of some type, DNA or RNA, never both, and some kind of protein shell. That's the architecture. Period. HPV, common cold, polio, hepatitis A. Okay, so here we are, never both. We're trying to set a never both record today. That's right, keep counting. Once I get over 25, it's never both. We're used to single-stranded RNA and double-stranded DNA. Viruses don't follow that rule book. Thankfully, you don't have to know the strandedness of this. Okay, you do not. All you have to know is they're single and double. So we see single-stranded DNA and double-stranded RNA along with the regular stuff. So there's a lot of new. I don't teach this here. I don't feel it's that relevant to us. You know, there's some things you'll see I skip because you don't need it. They're very, very, and they're super specific. Understand, and I'm not telling you to go do this. Okay, believe me. But if you have a gastrointestinal virus all over your hands, as long as you wash your hands properly, it's not a problem. It's got nothing to attach to. As long as your skin's intact, there's no way getting in. We have it basically is spread by something fecal to oral. It's shed in feces, and we consume it orally, or as we like to say in our house, eat shit and die. Sorry about that. I thought that was clever. So, with my mom growing up, I always wondered. I said my parents didn't swear until I was 21, and then after that they never stopped. Okay. My mother used to tell them to pound salt. You know, and then subsequently she informed me what opening that individual was supposed to pound salt into. You might guess. Okay, very, very specific as to what they attach to. The same thing with a respiratory virus of any type. If you sneeze and you can't grab a tissue that quick and it's in your hand, just wash your hands. It's nothing to attach to here. But if you touch somebody else, and remember we say this all the time, touch our face 5,000 to 8,000 times a day. If that person, you saw them, there was something here on the table, okay, put your hand on it. If there's any degree of still active particles that were in there, typically associated with moisture, you touch your face, now you have a chance to inhale. Now, if you touch food and it's fecal to oral, now you have a chance to ingest it. So you've got to be careful with things like that. Okay, taking control of the host cell, we talked about that already. They typically have to utilize all the enzymes. Some viruses come complete with enzymes. The most famous of all of these, HIV. It has a special enzyme that reverses transcription. It's an RNA virus that gets rewritten as DNA. We will get to that. So they have to hijack enzymes for replicating. They have to hijack enzymes for making proteins. They hijack all those. So hosts and diseases they cause is something we're going to talk about. You're going to hear a word called range. Range does not mean geography. Okay, COVID was all over the planet. We know that. The range wasn't all. That's, I mean, the extensive range was to hit multiple species. Okay, COVID was a confluence of viruses that affected a lot of different mammals. It affected humans. It affected pigs. It affected bats. It affected, and these are all mammals. Horses, things like that. Influenzas like that. Multiple species can get that, and that's when we get these novel viruses. They get little pieces from different species that your immune system gets, and we'll cover that in this chapter to a certain extent, and very much so we do respiratory diseases. So we look at the range. So something that has a broad range is that. Something that has a narrow range, okay, may affect only humans. As far as I know, I think measles is only humans. That doesn't make it less significant, less potentially deadly. Okay. I mean, that's some of the misunderstanding. And you'll get some of my vaccine philosophy with regard to that. But measles, I'll say this again and again, is the third largest killer in equatorial Africa. Despite, as far as I'm concerned, a relatively safe immunization for it. That's what the opinion on the safety is my spin. So people say, well, measles, I nobody ever died from measles in this country. They did, yes. And number two, better healthcare system. I'm talking about sub-Saharan Africa. So we look at the range, we look at their structure, the chemical composition, and all that stuff, similarities in genetic makeup, and then the committee began to look at it. So obligate intracellular parasites is this answer, and then we're going to look at the other stuff. So here, virus size range. Now this range is size, not range in the sense of epidemiology. They are the smallest, with the exception of some of the proteins, the prions, which we get to in this chapter, probably rival that. Parvovirus, very small. Who gets parvo? See? Dogs. Have you ever seen a dog with parvovirus? Because most now they're immunized mostly now. That's part of the, like, one of my fur children is residing for the next 7 or 8 days at CBW, Camp Bella. I dropped in there this morning. I could hardly restrain him coming in there. He's very happy. Now he has to have all those immunizations. They spell it out for you. You're like me. Your vet does those. Hey, who do you want to? Fax them to here, email them to there, wherever he's going. Play parks, wherever you go to. Okay. Parvo is a virus that typically, bless you, that affects animals. We had a dog who got parvo from being kennelled years ago, and we were in the process of adopting my oldest. It's like 40 years. Wonderful dog, to say the least. I mean, vomiting and diarrhea, both with blood. Most dogs died. He fortunately survived from regard with that. I mean, when you hear the term sick as a dog, that was a perfect example. It was awful. We get parvovirus. Okay? We get a parvovirus that many of you already have had. It causes something that, if you ask your moms and dads, it's called slap cheek syndrome. Okay? It looks like you smacked your parents don't want to admit it. They want to take them to because it looks like you smacked the kid. Okay? My parents had to never stop. Okay? But nowadays, oh my God, they're going to take the kid away. Please. It's actually called, it has a fancy name that we're going to get to when we look at skin diseases, because it was the 5th most common type of skin disease before you bacteria and viruses. 5th disease. Even though it's based on the number, not on somebody named 5th. And that is a parvovirus, interestingly. So we do get that. It's a mild skin disease. Many of you have had it. It's characterized by a fever of 101, 102, mild, and cheeks get very red. That's all. A lot of viruses get rashes associated with them. So Largest viruses, herpes simplex is pretty large, okay, comparatively speaking. Smallpox, very large. Again, as far as we know, it's been eradicated. Doesn't mean it doesn't exist, but we have not seen an active case. And so we had some of these that are more cylindrical or helical, can be very, very long, even very narrow in diameter. So you got to be electron microscopic. Here, you've been looking at bacteria. Here's staph. Most of you saw staph or Micrococcus luteus in lab, right? Last week, right? Micrococcus, a little bit smaller than Staphylococcus, right in that ball game. Here you can see a yeast cell, red blood cell, E. coli, Staphylococcus. Let's take a look. That looks, I think that's, I do not know. Here, rickettsia we'll get to. That's actually a small bacteria. Herpes simplex, rabies, HIV, influenza, getting smaller. Adenoviruses cause a lot of colds. We'll get to bacteria. Here's polio, yellow fever, which is in a different category. You can begin, and here you can see a molecule of hemoglobin. Tiny compared to those yeast cells, compared to that staph. Think of how many of those polioviruses, much less a human cell like that, you could get into. Boggles the mind. Very small. For instance, that's probably rabies. This is probably an adenovirus of some type without me looking at your captions in the e-text, and that surely is Ebola. Ebola is known, it used to, when they see it under the microscope, they call it a shepherd's crook. So it has like a staff and then like that curve. But there's variations on it. So it's pretty much of a giveaway. Rabies kind of looks like this, sort of bullet shaped, but electron microscopy, depending on the enhancements, will show that. So as you can see, no resemblance to cells and lack any ability to really make proteins on a regular basis. The RNA can direct it, but it's not there to make it. And so you're going to see the structure, regular repeating subunits that give rise to the appearance they look like crystals. They have a fancy term for these components called capsomeres, as you will see. So they're identical. Okay? And depending on these capsomeres, sometimes they form equilateral triangles. That's the isometric. Other ones kind of form a tubular structure, like you're wrapping tape around a hockey stick or a bat. You know how you reinforce a hockey stick at the grip and the handle like that. Hockey players without tape are like, they don't know what to do with themselves, right? Like they've got tons of tape. Whatever they need to invade. That's it. Maybe a couple of enzymes. It's called the capsid. That's the protein enclosure. And the genetic material that's inside, when we add the two together, we call it a nucleocapsid. And take the common cold. It's a naked virus, no envelope. That's it. The essence of simplicity. And basically, it invades one of your respiratory cells, takes over that cells, makes 500,000 of those, and boom, they spread. So all of a sudden, you felt that cold coming on, and then 2 days, a day later, you're like, oh my God, I feel lousy. On the other hand, how many times have you felt that cold coming on, and all of a sudden, and you go, and the next day you go, oh, I feel better. What happens then? Your immune system, it's a numbers game. You hear me say it again and again, both for bacterial infections and for viral infections. If it's a limited amount of infectious dose, your immune system can get on top of it, destroy it before it gets too much on you. The whole idea of immunizations is it pre-encodes, and you'll learn about this in immunology. We do this more, I do that more in A&P than I would do it here. You basically, it encodes that information in your system so the next time it comes, you'll ramp up right away to be able to fight the infections. That's the beauty of it. So the capsid, now the envelope, you're going to see down the road as it kind of spits out, and in one of these little viral factories, on its way out, it picks up a little bit of membrane and some protein spikes that are embedded in the membrane, and voila, that's how it attaches. So we see spikes are how they attach. You're going to see the illustration shortly. Spikes are either on the capsid or they're on the envelope. It's all about the spikes. Viruses have no idea what they're going, but if they come in contact to a receptor with one of those spikes, they adhere, and then all of a sudden there's a whole process where they become inside the cell and start to do business. Allows viruses to dock with host cells. Very specific. As I was saying before, it depends on how they're transmitted. You're going to learn there's 4 ways they're transmitted: fecal to oral, and typically it's the way they spread. So typically that's gastrointestinal, with some exceptions. Respiratory, very COVID 101. How's it spread? We inhale it, we get sick, we cough, etc. Okay. The interesting ones, zoonotic, which means it comes to us from another member of the animal kingdom, typically rabies. Okay. If you did not know it, it doesn't have to be. A human can transmit rabies to another human. Were you aware of that? Okay. You should be if you're going to be in a nursing or treating patients. I will tell you the anecdote here and probably revisit it when we talk about rabies. This is a good more than 40 years, 45 years ago. My first wife, up the street, 2 doors from her mom and dad. We lived on the same street for quite a little while when I first moved to Pittsburgh, up in Stanton Heights. She was a nurse at where Children's is now, used to be St. Francis. St. Francis had a big alky and druggy detox unit and a psych unit. They had a patient on the psych unit. She was psyched. And the guy was just going nuts. And, she's trying to take care of him. And as she bent over, it was a teaching lesson. Got a little too coaching. Guess what he did? He bit her. About X number of days later, he died. And they tested his brain and his saliva. Guess what? Rabies. So they did not know, but rabies is fatal if it's not treated. He apparently wasn't. She had to undergo, at the time, a very unpleasant way of treating rabies. It has improved, thankfully, now. But it used to be horrible. So that is a case of human-to-human rabies that happened. And so if it happened to somebody we knew, now that psych unit's long gone, that's all part of the big complex. There's Children's up there in Lawrenceville. It's a great place, and they've done a fabulous job with that, because it was, that was what that hospital was known for. They made its revenue with alcohols and drug and psych more than it did anything else. And eventually UPMC just absorbed it. I was on staff at a branch. I operated St. Francis Central, which I think I've told you is where the Pens play, at the arena. That used to be called Central Medical. So moving on. So that's part of it. So the spikes are very, very significant. And the last wave, most of you heard about, we call it STDs. That's really a bad term. The best way to understand it is blood, body fluids, or close, intimate contact. Skin to skin. HPV is much more about friction and skin coming together than it is about blood or body fluids. It's a skin virus. So if you think of intercourse, whatever kind of intercourse, that's the frictional component. That's how it's not so much in the fluids per se as something another viral disorder might be. The same thing with herpetic viruses, like genital herpes would be much less about the secretions than it is being on the skin. And we'll cover all that when we talk about STDs and all that kind of stuff. Here's the big teaching example. This is a naked virus. This is the envelope. These are the spikes. So why is this tougher to kill? This is a classic isometric virus. It's got all of these sides are equilateral triangles, 20-sided die. All of those spikes are how it attaches. Here's very similar. They're trying to draw the same thing here. Here, the spikes are on the envelope. Why is it easier to get rid of these? Envelopes are made out of membranes. What can get rid of them? We've got one right over there. Okay. Hand sanitizer. Alcohol reliably destroys what are called enveloped viruses. Easily. Simply. Does it last long? No. Alcohol evaporates in about 15 seconds. You'll see that's in one of the units we're doing after this. Method of control unit. Easy. So here you got them. Enveloped viruses versus naked. Here, there's no easy target. Much harder to get rid of. I mean, you have to do some substantial treatment. You're going to have to use a good-sized disinfectant, not something that alcohol was classified as an antiseptic. It's useful on skin. It's safe enough to be used on your skin. It's most likely not going to be strong enough to get this bad boy out. We'll get into all of those. The capsid, the identical subunits, capsomeres, they self-assemble. Here are the two big ones, helical or icosahedral. Again, we use the term isometric. Some people use the term filamentous, but really that's their formal name, as you will see. And then we have oddballs. Okay, and there's a fair amount. Influenza is kind of an oddball. Okay, pox viruses like smallpox, kind of an oddball. You may not have known it, but there's a sexually transmitted disease that's a pox virus. It's got a great name. It's called molluscum contagiosum. We're going to be stuck having an STD. That would be a good one because you can get rid of it. Not wishing it on anybody, but again, it's frictional. And it's not, doesn't cause any internal damage. It's just confined to the skin. And you just have to numb it and cauterize it. And hopefully don't get too close to that other person again. Close up, much as I'm going with that one. You know me, keep it clean. We're not G-rated, sir. But we don't want to be X-rated. R. My dog is officially R-rated. R. She's another R. She's R-rated. I thought that was clever. You're going to miss this for a week. Admit it, aren't you? See, when I do the dictations, it's vanilla. No, it is. So, bit of membrane, when they're released, they can get that from the cell membrane, from the nuclear envelope, and the plasmic reticulum, who cares? So, more flexible than the capsid, so enveloped viruses typically are a little bit more inclined to be pleomorphic, meaning they have some oddball shapes. That's broad brushing. So here, naked versus enveloped. You can see the difference. The helicals are rod-shaped. This is what I meant by sort of forming almost like a tubular structure, so you're wrapping a hockey stick. Naked. I mean, you can look at some of this. I'm not going to ask you about this. The type of morphology is found in several enveloped human viruses. Influenza, measles, rabies. There are so many types of things that are there. Okay, you'll begin. Influenza is an oddball. This is kind of like they're trying to determine. It's not typical. We really classify this. So here you can see naked adenovirus, a cold virus. You can see the spikes that are there. Enveloped, hepatitis B, herpes simplex. Sort of looking over there. Just to give you some ideas without going crazy with it, here's a 20-sided figure, evenly spaced corners, blah, blah, blah. See that? It exists. Thankfully, we don't get those. That's truly a complex virus. This is, and really the other classification is two types. We have what are called animal viruses. It's a misnomer, but effectively that's what affects animals, so that affects us directly. They hit our cells. Versus what are called bacteriophage. And sometimes they're nicknamed for short phage viruses. And they affect, as you might guess, bacteria. You get some really funky looking ones, and that is one of them. That's T4, I think. Just had a brief name. This whole assembly, you can see it for real. You see the surrounding E. coli, for example, one of the ones that can actually give it deadly properties. This whole assembly is, there's a nucleocapsid up there. It looks pretty routine. The rest of this assembly is nothing more than a syringe that injects that genetic material into the bacteria. Yes?
Just a question. So if they can't affect us, could that be a potential treatment for E. coli?
Absolutely. That's what we look at. We're studying bacteriophage now because we're running out of antibiotics. And so they're studying bacteriophage because what they do is they eventually destroy or change the bacteria. So you'll see more about that. I don't do it in the scope of the course, but it's one of the research areas that they're looking at. This is one we can use in our lab here, doing bacteriophage studies because they don't hurt us directly. So what you'll see on your plates that you have in the lab, you'll see like clear areas where the bacteria don't grow. We do not know if we're doing it in genetics this time, but it might be. Genetics runs in all levels for nothing. This whole thing is the way of attaching. So we're going to talk about those bacteriophages limitedly as we move forward. But that's enough. I'll see everybody hopefully in a week. To be very honest with you, I do not know if I will be on site that Monday morning since we get in. I probably won't walk in the door till 1 o'clock in the morning. But I may be here, I may not. But I will, of course, let everybody know.